What is pre-implantation genetic testing, or PGT? Hi, I'm Dr. Chong Seong from Alpha IVF. Today I'm going to talk about PGT and whether is it a suitable procedure to add on to your next IVF cycle. Pre-implantation genetic testing is a reproductive technology that is being employed in your IVF cycle to identify genetic or chromosomal abnormality in your embryo before we transfer inside your womb. A little bit more information about chromosome. Chromosomes are found in each of our body cells. Normally we have 46 chromosomes. 23 of those chromosomes are from our mom and another 23 chromosomes are from our dad. So total add up will be 46 chromosomes. Each chromosome is like a book. It carries specific genetic instruction. Like chromosome Y, you carry genetic information for a male, and chromosome X, it will carry genetic information for a female. Okay, there are three types of pre-implantation genetic testing. The first one is termed pre-implantation genetic testing for aneuploidy, which is commonly known as pre-implantation genetic screening, PGS, previously. This is the most commonly used PGT technology in an IVF cycle. This technology can help us to identify the 46 chromosomes in the embryo before we transfer back into the womb. How is this PGT being done? It's using a technology called next generation sequencing. You may want to consider PGT-A if you want to increase your IVF pregnancy rate, you have previous recurrent miscarriages, you have a previous failed attempts of IVF, or you have a pregnancy that complicated by chromosome abnormality such as Down syndrome, or your partner may have severe male factor infertility. These are those conditions that you might want to consider PGT-A in your next IVF cycles. The second pre-implantation technology is called PGT-SR. SR stands for structural rearrangement. This is for couples who have already known they have translocation, duplication or inversion in their chromosome. The third and last technology is called PGT-M. Stands for pre-implantation genetic testing for monogenic disorder. This is for couples that have a known inherited family condition such as thalassemia, spinal muscular atrophy, cystic fibrosis, hemophilia, and many others conditions. The goal of PGT-M is to establish a pregnancy that is not affected by the specific genetic characteristic carried by one of both biological parents. Okay, how is PGT being done? When you are doing your IVF cycle, you may be offered PGT as an option. In the laboratory, after the egg retrieval, the egg is fertilized with the sperm to become an embryo. And this embryo is further cultured into a mature embryo, what we call blastocyst on day 5 or day 6. It is at this stage, few cells are taken from the blastocyst and sent to the genetic lab. These cells are analyzed using the next generation sequencing technology to identify any genetic or chromosome abnormality. Hopefully, we can find the one that can make it to a baby or live birth. Sometimes we come across patients with special conditions such as thalassemia that require IVF with pre-implantation genetic testing. In those patients, let's say presume that both of them are thalassemia carrier. So in doing IVF, they will require PGT-A, which is to screen the embryo for 23 pairs of chromosome. And they also require PGT-M to identify whether the embryo carry any of the thalassemia gene. So in alpha IVF, we can use this technology called ion torrent next generation sequencing by doing both tests concurrently in a single platform. This will also reduce the risk of damage to the embryo, because in some platform they will be requiring 2 biopsy. In alpha IVF, we can use single biopsy and we can run the 2 tests concurrently. I hope you found this information about pre-implantation genetic testing useful, and I wish you all the best in your next IVF cycle.